Good evening, everyone. My name is Jack Stobo, and I'm president of UTMB, and I want to add my congratulations to the AOA inductees. We have a very special event tonight. It's the first presentation of a very special award at UTMB. And tonight's presentation is actually about three people. It's about Sir William Osler, it's about Dr. John P. McGovern, and it's about Dr. Ray Remmers. William Osler was arguably the greatest generalist physician in the history of the world. He was born in the backwoods of Canada at Bond Head in 1849. For the next 70 years of his life, he practiced, taught, and wrote about medicine. First as a professor in the Institute of Medicine at McGill University in Canada, then as a professor of clinical medicine at the University of Pennsylvania, then as the first chairman of the newly created Department of Medicine at Johns Hopkins University, and finally as the Regius Professor of Medicine at Oxford in England. While he himself was not a discoverer, he championed a scientific approach to medicine based on the findings of others. He was an observer and a scholar of the natural history of disease. His prowess as a clinician extraordinaire was known throughout the world. He was a prodigious author with over 1,600 written works, including his single-authored textbook, The Principles and Practice of Medicine, the first modern textbook of medicine. While he was a renowned teacher and clinician, he was most importantly a humanist. He demonstrated extraordinary compassion and respect for his patients. Indeed, the term Oslerian medicine has become synonymous, not simply with extraordinary teaching and clinical acumen, but more importantly, with a humanistic, compassionate approach to clinical medicine. The second individual who we recognize tonight is Dr. John P. McGovern. Born in Washington in 1921, he received his MD degree from Duke University School of Medicine. He rapidly became a distinguished pediatrician and allergist who developed close ties to Houston and, fortunately for us, to Galveston. Beyond this local scene, Dr. McGovern has had a major impact of American medicine, reflected by his receiving 12 honorary degrees and leading many major medical societies. With regard to tonight's activities, his most significant contribution, in my mind, has been his untiring advocacy for humanism in medicine and the promotion of Oslerian principles in the practice of medicine. He was a major force in establishing the American Osler Medical Society in 1970, a society dedicated through its writings and meetings to champion the Oslerian approach to medicine. It's in recognition of the importance of the Oslerian approach to medicine and in recognition of Dr. McGovern's commitment to sustaining this approach that we have established the John P. McGovern Award in Oslerian Medicine at UTMB. The third individual we're recognizing tonight is Dr. Ray Remmers. Dr. Remmers is the first recipient of the John P. McGovern Award in Oslerian Medicine. Candidates for this award draw from a large, distinguished group of physicians, including UTMB faculty, UTMB alumni, or members of the UTMB residency program. To receive this award, the candidate must exemplify the Oslerian ideals, which include a combination of scientific principles and humane practices, social consciousness and community involvement, and exemplary personal attributes of honesty, modesty, generosity, and respect for the past. Dr. Remmers received his MD degree from the University of Louisville School of Medicine and completed his clinical training at UTMB. He is a clinical professor in the Department of Medicine and the Division of Nephrology. He was the unanimous choice for this award by the selection committee. Let me quote from some of the nomination letters for Dr. Remmers. His greatest impact is his commitment to the education of young physicians through his intelligence, honesty, and compassion. In the care of patients, he has taught physicians, young and old, to do what is best for the patient. In reference to his care of patients, it was further stated, he never became their God, never made them dependent, and never left them without hope. It's a pleasure for me tonight to honor these three people, Sir William Osler, Dr. John P. McGovern, and Dr. Ray Remmers, and to present the first John P. McGovern Award in Oslerian Medicine to Dr. Ray Remmers. Ray, if you'd come up.
That's a pretty powerful company I'm keeping, Dr. McGovern, Dr. Osler. I'm deeply flattered. First of all, I too would like to congratulate all of those that have been last year and this year elected to AOA. To graduate from medical school is a great honor. All of us feel that. To be elected to AOA is simply icing on the cake. This is really the tops. And I would like to again congratulate everybody. I'm deeply honored at receiving the John P. McGovern Award. When you look at all the qualifications that are listed, I don't see how in the world I could have measured up to any of these, really. They're astounding, but I am greatly flattered by this. It's when you think of that, this basically came from my peers, then it's doubly satisfying to me. Osler is certainly the patron saint of clinical medicine. He dedicated his life to, as Dr. Stobo said, to scholarship, teaching in humanitarianism. These were premier with him. I would like to cover a few highlights as I see them in Dr. Osler's, the award being named for him. I'm a little reluctant to do it, a little nervous about it because Dr. McGovern is the world authority on Oslerian medicine. He knows more about it and has published more about it than anybody else. And certainly I would hope that he could give us some comments after I've finished. But we'll get started because I think there are just a lot of people, parents, other people in the audience who really don't know Osler well at all. Could we have the first slide? This is his official portrait that he got when he was awarded the chair at Oxford and became Sir William Osler. But he was born humble beginnings in 1849 in Canada, as Dr. Stobo said. He died in 1919, a ripe old age of 70. And that day and time, achieving the age of 70 was quite something. He was a Canadian by birth, by upbringing, and he was what most people would consider was a British subject at that time. He was raised in Western Ontario, was schooled in Toronto, and finally at McGill University in Montreal, which was certainly the premier school, one of the premier schools in the United States and Canada together. He then went to Europe for 3 years. One of the astounding things about him was that he was a compulsive, detailed note taker. He took notes on everything, every single patient that he saw. He took notes on, described their entire history, their physical exam, what he saw, and if they expired, the autopsy findings also were noted in great detail. I'll come back to this in a minute. He then became a professor at McGill, later at the University of Pennsylvania, and finally was appointed as chairman of medicine at the brand new Johns Hopkins Hospital in Baltimore. This was before the hospital was even finished, had not accepted patients. William Osler, being the hard worker that he is, used this period of time, this 2 to 3 years. He commandeered a OB-GYN residence room and study area that was on the campus at that time, and wrote his textbook of medicine. He didn't edit it, he wrote the entire thing. A phenomenal achievement. It was more than 1,100 pages, and I went over to the library, and the Blocker collection, of which Dr. McGovern had a lot to do with, and read the first edition. And it was astounding. I was almost afraid to pick it up. It was so beautiful and so well written. It was difficult to read. The Victorian language is quite precise, but quite difficult to read. Could we have the next slide now? This is actually the 4th edition. Again, this was a monumental achievement of Osler alone. No one else did this at all. The ordinary textbooks, as you know, usually are co-authored by maybe 20 or 30 different individuals, and there's a single or 2 editors. He wrote the whole thing. He used his notes from seeing the patient encounters, the autopsy examination, anything else that he had available. On the right is the table of contents. They haven't changed a whole lot in these 100 plus years. Only the content has changed. This actually was the 4th edition, which was, I believe, 1902. The first one was 1892. Have the next slide. I really like this slide. It shows Osler hard at work writing his textbook. This is, again, before he became the chair of medicine, with his sleeves rolled up, a messy desk just like mine. All great men have messy desks. And so, but it was, that's why I think I enjoy it so much. But again, a phenomenal achievement. What this did was this took medicine out of being an art and out of witchcraftery and made it a science. It clearly threw it in the realm of a science. And Osler, related to this, plus his own abilities, became basically the most famous clinician in the United States, in North America at that time. Could I have the next slide? This one doesn't show well, but it's a portrait by John Singer Sargent, showing the it now hangs in the library at Johns Hopkins University. They appointed 4 key people to fill chairs there. Whoever the dean was certainly brilliant, but there was Welsh, there was Osler's in the 2nd position. Halstead is the one standing, and then the 4th one is one I'm not acquainted with. But it was absolutely, it it's extremely well done, and I like it a lot. Shortly thereafter, he changed his writing completely. He kind of, in his own mind, finished the textbook as he saw it, went through the editions as noted, and he began writing essays. He wrote many essays on many different subjects. He was a favorite to give graduation addresses. He constantly challenged the younger medical student to perform in a fashion that was similar to what he did, and that was competence, integrity, lots of hard work, but with compassion, and these have carried forward to today. Other things that he did, just almost as a side, is that he designed the current methods of residency training. They've changed very little from what they were back in the Oslerian time. He's the first one to introduce medical students to the patient. This was not done before, and also interns and residents to the patient. The next slide, I think, shows this. This shows Osler taking the temperature of all things. You'd think that he was too great to do something like that, but that's not true. And the next slide shows the Amphitheater, which is, this is at McGill University in Montreal, virtually identical to the Amphitheater in Old Red. Patients were wheeled in, and grand rounds is not like grand rounds today, Dr. Powell. In those days, grand rounds was a discussion of a patient, and you did your best to try to figure out what was wrong with the patient. Today, of course, it's quite different than that. I think you can turn off the slides now. These are, some of these are courtesy of Dr. Jean Boisebin, by the way. My wife, not Osler's wife, but my wife of 46 years, is a mother, is an excellent writer, an extremely bright person. She's also my alter ego. And I think enjoys telling me when she thinks I'm wrong. Anyway, she said, I think they would like to hear, what makes you tick, what's going on with you, how did you get to where you are today, in addition to what's happening to Osler. Today, Dr. Foster basically discussed the maintenance health organizations, medical legal entanglements that we can all get into. These are large social issues that have, in a gigantic way, have impacted medicine. They've kind of made it the way it is today. We have to cover ourselves at all times because of this. And the medical, these again are not really medical issues, and they won't be discussed at all by me, but are rather social issues. When I started in medical school, bacteriology, parasitology, and all that was in firm place. Lots of textbooks written about them, but we had no antibiotics at all at that time. It was only after about 1952 to 55 that Fleming discovered penicillin, sulfas were developed, and that opened the era of antibiotics. We now have more antibiotics than we know what to do with. But certainly this was an important feature of bacteriology and having people survive longer. More importantly, has been immunizations. My wife and I actually met each other at the acute polio ward at Louisville General Hospital. She was all of 19 years of age, but was highly regarded apparently, and she was the student nurse designate to care for the patient, the acute patient on a ventilator, which was the iron lung at that time. I was there taking up space, and I knew really almost nothing about that at that time. I quickly learned, but I do. Poliomyelitis was a dread disease. A large majority of young, previously healthy people died of this condition. And what's happened in just a matter of a few years, it's no longer a disease. Because of immunization, it's totally wiped out. We don't have to put up with these tragedies anymore, and it's been a great, great step forward. So these two things really happened when I was when I graduated from medical school. But they had a deep influence on me. Since then, life expectancy has greatly expanded. People now commonly live to be 80, 85 years old, and they often do quite well. What's happened is there's been a virtual explosion of diagnostic tests that are available, both tests on the blood, but more importantly, radiological tests and endoscopic tests. We can now image almost anything, anywhere, anytime, and usually quite accurately. This has had a great influence. I know Dr. Cotton, who's in the audience and was my fellow, knows what it was like to try to deal with ultrasound without having ultrasound to help image the kidney and to do it very accurately over and over again. So these have also happened and have had a tremendous influence on medicine. And finally, we have found ways to keep people alive longer. Before we had nothing in the way of artificial kidney support, ventilators, transplantation. None of these happened until basically later on in my career. When I received a large NIH grant when I first got out of my training, and we were the only ones in Texas besides Southwestern to receive support for hemodialysis. That was an amazing thing because a very, very expensive form of therapy, very effective, but very expensive. We had selection committees to pick patients and decide who was the most suitable, both socially or medically, for this form of new treatment. It turned out to be a hugely successful form. So good, in fact, was that it was adopted by Medicare as the only patient, or the only disease pinpointed for funding. Only kidney disease and nothing else was funded by Medicare. We now have franchise dialysis, almost as many as McDonald's hamburger stands. They're everywhere, and patients are receiving dialysis. For the most part, they're benefited by these, but it's not like it once was. These are now are patients who have a lot of serious illnesses, and their prognosis is really much less than you would say good. Transplantation, this has become the era of immunology, and transplants are now very solid, are predictably good. 90% of patients who receive a renal transplant have kidneys that are alive and functioning at the end of a year. At the end of 5 years, at least 50% are. But back in the beginning, it was simply amazing. I had one patient I saw today who was placed on home dialysis 33 years ago. He had that for 11 years and then had a renal transplant that he had for 20 years, for a total of, I think, 33 years. This is a man who has raised 3 children, 8 grandchildren, and would otherwise be dead if these things were not available. There are many other similar stories to this one. Also, we now have in the formative stage liver transplant, heart transplant, and pancreas transplant, which is fairly solid. All of this has led to a prolongation of life. Patients live longer, about 74 years of age, total, females much more than males. And because of this increase in lifespan, we as physicians now must take care of a lot of patients who have chronic illness. Before you didn't have this, but now they almost all live for a long time. And we're confronted with the care of these patients. We've developed and had to develop almost in self-defense in order to maintain our competency as a physician is to maintain problem-oriented medical records. All patients will have a list of problems, and they'll have associated data with them. And then from that point, you're expected to give quality care. I think many of the older physicians become very concerned about this because they think that the trainee or the medical student is going to skip over all of the things that are in the medical record and go directly to what they perceive a patient's problem and never do a history and physical on the patient. I would hope that never happens. It certainly has not happened to any of the students and trainees that I've been associated with. Finally, what basically works for me, what I like to say in the students and residents get sick of hearing is to do what's best for the patient, whatever it is. Just do it. Usually you can get a pretty good idea of what needs to be done to the patient, but sometimes it's hard to. There are several other factors that can make this very difficult to do. But when you think about it, it's not really very hard. The first thing one needs to do is to maintain. As we get older, I think we tend to become less clinically competent if we allow ourselves to do. If we allow ourselves to, we try to kind of rest on our laurels. You can't do this. You've got to maintain your level of competence. Like for me, it's difficult to stay abreast in immunology. I have to really work at it, but it's critical in terms of making the right decisions to do that. And so that basically is number one. Number two is to know the patient cold. If you're going to make a judgment on the patient, do what's right for the patient, then you need to basically know him very well, or have one of the key observers who's gone over him and who's so on. This also needs to be done. As Osler said, competence without compassion, it lacks humanism totally. Compassion without competence is a fraud, is a medical fraud. And what we should always try to achieve is competence with compassion. This is ideal, and what we should always strive for. I think at this, the hour is late, and we'll stop. Again, I'm just astounded and amazed that I have received this award. Very humbled by it, but I accept it. And I would like to point out as you go through this just how, even though the sayings and the of Sir William Osler are quote-unquote Victorian, how sound they are. The other thing that I'd like to take from Dr. Foster today is how thrilled I am to be a physician. I think all of you will feel this as you go on. And the older you get, the more you feel it. Boy, oh boy, I am so lucky. And it's such a thrill to be a physician. Okay, thank you very much.
The actual award is a sculpture done by a Galveston sculptor, David Moore, which is William Osler sitting in a chair, and then on the bottom there's a picture of John McGovern. I'm going to ask Jack, as I know, McGovern to come up. He and I talked today, and he said he wanted to take this opportunity to say a few words, but let me just say a few words about Jack, in addition to what I've already said. I wish that Jack and I shared more than a first name, because he truly has been a remarkable individual. And it continues to delight me to see how a single individual in different situations can have a tremendous impact on an area. And that certainly pertains to Jack, who's had a tremendous impact on American medicine, on humanism in medicine, on the concept of Oslerian medicine, and on UTMB. And in recognition of this, we want to present him with an award, which is Osler, sitting on a marble base. And the inscription says, "Presented to John P. McGovern, MD, on the occasion of the first John P. McGovern, MD Award in Oslerian Medicine by John D. Stubbo, President, University of Texas Medical Branch, May 25th, 2001. Jack, thank you for everything you've done for us.
Well, in that I have what I call galloping lethologia with a bunch of AOA folks in here. I'm sure that they are wondering what that is. It's not in the medical dictionaries yet. Which meant I promised my wife that if I was to speak at any time, at any meeting, if I had more than one sentence to to, see, I got a little ethologia to say, I better write it all down. So I've got it here. And I want to thank you, Jack. We have two things in common. My parents named me John and then called me Jack, and his parents named him John and called him Jack, and we both are rabid Oslerians. And it was so great when he came down here from Hopkins, holding the chair of medicine up there, the chair that Dr. Raymond Ressens mentioned. He was the first chairman of the department with Welch and Halstead and so forth. And we're just great, and everybody here is great that he's here. But if ever I heard a Oslerian, the man that received this award tonight, I just heard. So many things he said were just reminiscent of what things Osler said. And when he showed the object, this is what lethologia is. You can't get the words, you know the word you want and you can't get it. Some people call it senior moments, but I'm way past that stage. I haven't. So like Old Red going up, that's how all the schools were. And they come in to learn medicine just listening to lectures. And Osler, one of the main things he did, two main things, is he took the students out of the lecture hall and took them to the bedside. And in fact, on his I'm going away from what I promised I'd read here. That he would want on his tombstone, if any, that he taught the students on the wards. And the other great thing he did was to start so many great things he did that were mentioned by Dr. Reimers. And one was started along with Halstead, but he was sort of the real forceful one on it, and that's starting the system we have today of intern first now it's just resident, then residency, and that's used everywhere. But what I was going to say, but I guess I got inspired listening to the recipient of this award. That was just a beautiful talk. So I want to thank you, Jack. I'm more than grateful for this beautiful sculpture, and especially for your concept of the Oslerian Award. I know of no such one like that. I know some Osler lectureships, but no Osler Award. And that couldn't have been anybody, and I have never met Dr. Rammerston until tonight. You could just tell he has those assets, Oslerian assets, and action, word, and deed. Well, I was being asked to say something today, not to give a lecture. And to keep it fairly short, I'd like to give you just an Osler quotation with a brief comment that I think is pertinent today and all days and has always been. He said, I'd like to say first, there is today, as most of you know, much debate as to whether the practice of medicine is a science, an art, a trade, a business, a profession, or some combination thereof. Osler stated, "The practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head." Today, one could speculate that Osler might say, the practice of medicine is an art based on science, a profession, not a trade, a calling, not a business, a calling in which your heart must always be exercised along with your head. As technology and science advanced, Osler clearly would have realized that a physician should always be treating more than just a disease. The heart then signified, as was mentioned by Dr. Remmers, signified compassion, empathy, and humane, deep caring, as it still does. That is the essential ingredient that seems to many patients is often missing today. You hear folks saying that they feel like the doctor doesn't have much interest in them. It takes about 2 or 3 minutes, and I'm just seeing another number, and he sends me off for lab work. And I keep hearing sort of things like that, and these are tough days, as everybody here knows. And Jack Stobo came in here at the toughest times and is doing a wonderful job with a very tough thing these days. Everybody has it. All of the schools seem to have it, but to come in cold and do it's been marvelous. That's all I was going to say, except I see Ron down here, so I have to give another quote of Osler's. And this was in the last talk he ever gave in 1917 when he was president of the Classical Society at Oxford, the only physician that ever was. And one of the quotes in there that I liked, he said, "Twin berries on one stem, grievous damage has been done to both in regarding the humanities and science in any other light than complemental." Well, that's about all the words I think that you wanted me to say.
Thanks a lot.
Thank you.
That's terrific.
Do I get it now?
It's too heavy. You can't lift it.
Can I look at it?
Sure thing. Come on down.
I got a little. Oh, there's one other thing I did want to say. You see these people helping me up and down the steps. I haven't been drinking anything, but what I have is this galloping with both. But if I, with God's gift of 4 or 5 more days, on June the 2nd, I will join the 80 Club.
Congratulations. Thank you. Well, thank you all very much. Enjoy the rest of the evening. Thank you.